SEIU Healthcare Minnesota began in 1935 as Local 113 of the Building Services Employees International Union. Chicago janitors started the union in the 1920s, and it quickly grew to include other service workers such as window washers, elevator operators, and healthcare employees. Local 113 began by organizing similar employees in the Twin Cities, but soon focused entirely on non-professional healthcare workers. Throughout the rest of the 20th century, the union grew exponentially. Today, members include both professional and non-professional healthcare workers across the state of Minnesota. Local 113 was founded in 1933, a turbulent era for Minneapolis labor unions. Minneapolis hospital workers were the first to secure collective bargaining rights through Local 113. Workers in Northwestern, Swedish, and St. Barnabas hospitals elected to join in 1940. In 1941, workers at Fairview and Idle hospitals also voted to join the union, and a new section of Local 113 began in St. Paul. Over the next 2 decades, the union expanded to hospitals throughout the Twin Cities and as far north as Brainerd, Minnesota. Members were employed in a variety of non-professional jobs in the hospitals. They worked as janitors, nurses' assistants, switchboard operators, cooks, and laundry room workers. They worked long hours for little pay and had few protections on the job.
Before we had the union, we had to work split shifts, like 7 to 11:30 and 3:30 to 7:30. We had to work 44-hour weeks. We didn't get sick leave. We got, after working there a year, we got 1 week's vacation.
Workers represented by Local 113 negotiated contracts which improved wages, reduced the length of the work week, ended split shifts, and established procedures for complaints. Members were part of these negotiating committees.
You felt proud that you were in on a negotiation committee. I mean, that was something that, I felt was very important.
In 1947, Minnesota passed the Charitable Hospitals Act, which forbid both strikes and lockouts at nonprofit hospitals. Disputes that the employer and union could not settle went to mandatory arbitration. This law remained in place until the 1970s. Workers, however, found other ways to make their voices heard and improve their conditions. In each hospital, a union member served as a steward, writing up member grievances and ensuring that proper procedures were carried out during disciplinary hearings. Members also wrote to the union staff for additional support when confronting employers over issues of back pay, vacation time, and unfair dismissals. Local 113 members also maintained community through social events, which attracted large crowds from the locals beginning in the 1930s. Members brought their families to dances, fundraisers, and picnics. A holiday party was an annual tradition for decades and included music, dancing, and raffles.
They used to have picnics, then they went to Christmas parties, then we went to baseball night, I think back to Christmas parties. We just try to have a celebration event for our membership. You have to have fun too.
Members also maintained community after retiring. Local 113 had a retirees club whose members went on boat rides, picnics, and theater trips, and also worked on political projects addressing labor and senior citizens issues. These seniors benefited from the union's pension fund, which paid its first checks in 1968. Local 113 continued to grow throughout the mid-20th century. Membership expanded to nursing home workers by the 1950s. Workers from nursing homes across Minnesota approached Local 113. Staff members investigated working conditions, offered advice, and helped organize the workers if they chose to move forward. While there were many successes, protracted strikes in the 1970s and 1980s also led to some of the most painful moments in the local's history. These moments, however, also demonstrated members' strength and solidarity. Members held out through lengthy strikes in bitter Minnesota winters. They supported members at other institutions by traveling long distances to join them on the line and by donating food to strikers. By the late 1970s and early 1980s, licensed practical nurses across Minnesota began to join the union. Like the LPNs, workers at Group Health saw that their coworkers represented by Local 113 had pensions, higher wages, better health insurance, and a means of contesting discipline and dismissals. Their own successful June 1980 election added thousands of workers to Local 113. It brought many pharmacists, technicians, midwives, and social workers into the union, and pave the way for additional professional workers to join. The addition of so many professional workers marked another transformation in the union's mission.
These are not the classifications that typically sit down together. And so it was oftentimes very tense. And I remember lots of negotiations, just like listening to this group of people sit around the table and kind of watch them come together was absolutely incredible. At the end of negotiations, they were of the same voice, and the psychotherapist was moving the building engineer's message, and the building engineer was moving the psychotherapist's message. They were speaking for each other.
The union continued its rapid growth over the next 3 decades. It added new members as well as new protections for workers. Today, the members of Local 113, now known as SEIU Healthcare Minnesota, continue to organize for justice on the job and in the healthcare industry as a whole. Members have been vocal about the need for affordable healthcare for themselves and their patients. They have taken this and other fights to local, state, and national governments.
SEIU represents a lot of people that are low wage earners. Those are the people that need to be represented by unions. People working in hospitals, the orderlies, the nursing assistants, the non-professional employees in the hospitals and nursing homes in particular are doing tough jobs for very little compensation. Many of them are immigrants. Many of them are people of color that speak English as a second language. And the SEIU has very aggressively attempted to help.
I learned a lot through the union, how you could go about and work with people and be able to better yourself just by belonging to a group. Like they say, it takes a village, and that's how we worked at it, I think.
It is what we can do collectively that can make a difference in people's lives, and that it's not just your work life that we're trying to improve, it's your whole life, it's your family's lives, and that we really can make a difference together.
It made you feel that, yes, there are people that are with you, and you're proud to be part of it.